Hi, I'm Christopher King. I'm the Associate Medical Director of the Advanced Lung Disease and Transplant Program at Inova Fairfax Hospital in Falls Church, Virginia. And today we're going to talk about a general overview of the approach to pulmonary hypertension treatment. And this is going to be an introductory talk that leads to 4 separate lectures on the individual pathways that lead to development of pulmonary hypertension. You may have seen this chart before, but there's 5 basic categories of pulmonary hypertension that the World Health Organization recognizes. And these are grouped together because these disease states have similar characteristics and from a hemodynamic perspective, and also they are treated similarly. So the first group is pulmonary arterial hypertension. And so this is, I think, the thing that we most commonly think of when we talk about pulmonary hypertension patients. And so in this condition, patients have a narrowing of the blood vessels. And so this can be idiopathic in nature, meaning we don't understand exactly why it happens. It can be an inherited condition and have a genetic predisposition to it. It can be associated with autoimmune or connective tissue diseases and some other conditions like HIV, congenital heart disease, or liver disease. The second category is pulmonary hypertension that's associated with left heart disease. And so this is one of the more common types of pulmonary hypertension. And the pulmonary hypertension develops because of issues with the left side of the heart emptying. So that can be because it doesn't squeeze well, or the left heart doesn't relax well, or there's issues with the valves that cause that fluid to back up and affect the pressures in the lungs in the right side of the heart. This is treated very differently from the other groups, and the treatment focus in this condition is really focused on treating the underlying heart disease. The third category is pulmonary hypertension associated with lung disease. And so this can be seen with issues that cause scarring on the lungs, like pulmonary fibrosis or chronic obstructive pulmonary disease, among others. And so this is a fairly common condition, although it doesn't affect all patients that have those underlying lung diseases. The fourth condition are things that cause obstruction of the pulmonary vessels. And we most commonly see this with chronic blood clots, a condition that we call CTEPH, or chronic thromboembolic pulmonary hypertension. There are some other rare causes of pulmonary obstruction, but generally speaking, CTEPH is the main thing that we see in this fourth category. The fifth category is an other category, and so it includes some common conditions like sarcoidosis and hemoglobin disorders like thalassemias and sickle cell disease, but it's sort of a generic category that encompasses a lot of different conditions. It's worth noting that patients in the pulmonary arterial hypertension, the third, which is pulmonary hypertension due to lung disease, and fourth categories, all can be treated with medications that dilate the pulmonary vessels. And the same is true for some of the diseases that are in the fifth category. But we'll really, for the rest of the talk, focus primarily on that group 1 category, pulmonary arterial hypertension. So the treatment of every case of pulmonary hypertension is unique, and it's very important to make an accurate diagnosis. Within these categories, you get a sort of general approach to treatment. For instance, in the first category, we often use pulmonary vasodilator medications. It should be noted that not every patient fits neatly into a single category, and so there can sometimes be overlap. And so patients may have a mix of group 1 and group 2 pulmonary hypertension, and that can affect the approach to treatment. So a pulmonary arterial hypertension specialist tries to incorporate all of those factors and the information they're getting when developing a treatment plan. Other things that they have to consider are the severity of the disease. So patients with more severe disease may require more aggressive or treatment options. Also, the tolerance of the medication. So not every patient is a candidate for every medication or can tolerate every medication. Comorbid illnesses can affect which medications we choose. And then any decisions made about treatment need to incorporate the patient's opinions and preferences with regard to treatment. So, what are the goals of treatment for pulmonary hypertension specialists? We really want to slow disease progression and make people live longer, but that's not our sole focus. In addition to that, we want people to feel better and function better. So, we want to improve their quality of life and decrease their symptom burden, while at the same time developing a treatment plan that's going to minimize side effects of the medication, be affordable, and also not be so burdensome in terms of the requirements of that treatment that it affects the patient's quality of life. And then medically speaking, we achieve those goals by decreasing the patient's pulmonary pressures, which can lead to improvements in right heart function. And then we want to see patients decrease their risk of having events like hospitalization or death from progression of their underlying disease. There's a number of components of treatment outside of medications that are worth mentioning. Pulmonary rehabilitation can be useful in terms of helping patients gain exercise capacity and improving their quality of life. So that's an organized exercise class that patients can attend. If patients have drops in their oxygen level at rest or with movement, supplemental oxygen can be helpful in correcting that and can improve patients' quality of life and functional status. Medications to take fluid off, diuretic medications, are often a component of the treatment plan as patients with pulmonary hypertension are predisposed to fluid retention. And by giving them diuretic medications, we can make patients feel better and their right heart function better. Along with that, dietary modifications often necessary. Increased salt intake and fluid intake can sometimes lead to that fluid retention that I just mentioned. In some cases, anticoagulation is part of the treatment plan, but it's not required in all cases. And so that's something that's worth discussing with your pulmonary hypertension specialist. And then appropriate vaccinations are something that would be recommended by your PH specialist. So what about pulmonary vasodilator medications? We're really going to focus in on those. These are medications that dilate the blood vessels in the lungs, which make it easier for the right heart to circulate blood. And again, these are used primarily in pulmonary arterial hypertension, although they can be used in patients with PH due to interstitial lung disease or chronic thromboembolic pulmonary hypertension in the correct cases. And so when we use pulmonary vasodilator medications, you can use a single medication, although oftentimes we use a combination of medications which affect different pathways that lead to the development of pulmonary arterial hypertension. And currently there's 4 different pathways that lead to pulmonary hypertension that we have treatments that we can affect. And so those are the endothelin pathway, the nitric oxide pathway, the prostacyclin pathway, the newly not recognized, I suppose, but the newly treatable activin signaling pathway. And so we have drugs within each one of these pathways that can target that and decrease pulmonary arterial pressures, helping patients feel and function better. And so in our upcoming series of talks, we'll discuss each one of these pathways individually and the medications that affects that pathway. And I just wanted to mention that, again, these drugs are often used in combination of 2 or more medications, and that combination therapy is frequently preferred as it can improve outcomes. Specifically, there was a trial called the Ambition trial, which was able to demonstrate that by starting 2 medications concurrently, as opposed to starting one medication and then subsequently starting another, that they were able to reduce the frequency of or the rate of clinical worsening. There's a number of different combination of medications that can be used together, and it's up to your pulmonary hypertension specialist to evaluate a number of factors when developing that treatment plan. But their goal is for you to feel better, live longer with as few side effects and the least burdensome treatment plan possible. And it's important to remember that everybody's treatment plan is unique, just like every case of pulmonary hypertension is unique. Thanks for your attention today. For more information or resources, please visit phassociation.org.